Life Unrehearsed, brought to you by Caregiver Crosswalk, Dementia Care Consulting. Never roam alone.
And good afternoon. Welcome to Life Unrehearsed. My name is Matt Del Vecchio, specializing in life transitions, downsizing, and the senior living industry.
And I'm Corey Sirota, a clinical social worker and psychotherapist specializing in grief and loss.
Coming right up on the first half of today's show, we're very proud to have the Mayor of Hampstead, Dr. Bill Steinberg. Dr. Steinberg is a cochlear implant recipient and a real advocate for those experiencing hearing loss. Now that masks are the norm, and Corey, you saw me come in with a clear mask, it's been especially difficult for those people that rely on reading lips to communicate. So we're going to hear from Dr. Steinberg coming right up. And you heard Luciano on the news about the funeral for Father John Walsh. You and I were both almost in shock because we were about to reach out to him. We're doing a segment on December 13th about keeping the faith, and we were going to have a rabbi. In fact, you've got the rabbi already confirmed, and we were going to reach out to Father John. So we pay respects to him, and he has touched so many lives.
Absolutely. Our heartfelt condolences do go out to the family and also the community, because this is a real icon that we've lost.
Yeah, absolutely. What do we have coming up on the second half, Corey?
Well, in recognition of Crohn's and Colitis Canada Awareness Month, we're going to learn what can be done to help people suffering from IBD. That's coming up after the 4:30 news.
Yeah, it should be interesting. A lot of people dealing with IBD and all types of issues, and it's amazing how prevalent it is. So we're looking forward to have two wonderful guests coming up after the 4:30 news for that. All right, Corey, did you know, according to Stats Canada, more than 1 million adults across the country reported having a hearing-related disability. Hearing loss can lead to isolation and disengagement from social activities and is the sensory system people least want to lose. However, technology has come a long way with improvements in hearing aids and cochlear implants. And to hear more about it, we're pleased to have the Mayor of Hampstead and a cochlear implant recipient, Dr. Bill Steinberg, on the line. Welcome to Life Unrehearsed, Dr. Steinberg.
Thank you very much for having me.
Well, thank you for taking some time here on a Sunday for something that is very dear to your heart. You were born with hearing loss that progressed over the years. What was it like growing up with a hearing impairment?
Well, it's very difficult. I ultimately got a PhD, but elementary school was frankly hell. It's all based on hearing, and I didn't have much hearing. So it was extremely difficult. Things got better when I went to high school, more reading, university, graduate school, and so on. But it is definitely a serious handicap. It interferes with socialization. It's kind of ironic I ended up being a mayor. I'm someone who, for most of my life, would sit in the corner at social gatherings and rely on my wife to tell me what was going on. It really does cut down on people's ability to socialize.
So my understanding, Dr. Steinberg, is that your life changed in 2004 when you received your first cochlear implant. Let's start with, what did that procedure even entail?
Okay, well, an implant is, as the name implies, they insert a wire that goes through the cochlea till the very end where it meets up with the auditory nerve. There's a little round thing that fits neatly in the skull. The wire goes from that through the cochlea. And there's an external piece, speech processor. It looks like a behind-the-ear hearing aid, but it's very different because there's nothing in the ear, there's no sound. The speech processor changes sound into electrical signals, which then get transmitted and ultimately get up to the auditory cortex, and the brain fills in the gaps. There are only 20 electrodes with a cochlear implant, whereas your cochlea has 16,000 hair cells. So it can't do the same job of discrimination, but the brain is really quite remarkable at using it.
We're talking with Dr. Bill Steinberg, recipient of a cochlear implant and a real advocate for those experiencing hearing loss. That was in 2004. They did one. I believe you had a second one done later. Was it 2017 area? Was that
2018, I got a second one. The first one was magnificent, and I should caution people who are considering getting one. First of all, I recommend anyone who qualifies for an implant, in my opinion, should definitely get the surgery, have it done. The surgery is one of the safest surgeries that can be done, it's still a general anesthetic, but it's still it's very safe. I recommend it for anyone who qualifies. But people should have reasonable expectations. I'm lucky. My gains were about the maximum you can get and as fast as you can get them. So I gained a lot from that first implant, and it was shortly thereafter that I decided to run for mayor, and it became a possibility. It was certainly not a possibility before then. Nevertheless, I got the second one because it helps you with localization of sound, having 2 ears as opposed to one, and other such reasons.
Talk about a life changer, and it did literally affect your life. And I understand, the process probably is if you can get a hearing aid, that would be the first step. But you had to go through some pretty significant tests, I believe, in Quebec City at the time to see if you actually qualified for an implant. Is that correct?
The procedure has gotten better, but at the time of my first one, there were 3 trips to Quebec City to make sure you met all the hurdles, and in my case, it was kind of a close call, although it shouldn't have been. And then you got to go back to Quebec City for the surgery, and then you have to go back to Quebec City a month later for the programming of the speech processor. All in all, it adds up to quite a few trips and a lot of time. And there are people in Montreal who can't take the time, which means that some people who could have, as you said, a life-changing surgery are simply not getting it. And that's why I and doctors, audiologists, others in our group, we fought so hard for so long to convince the government to bring the surgery to Montreal, in addition to Quebec City, and set up the whole program over here. It's really so necessary. And I should mention that those of us in our group were all people who personally had absolutely nothing to gain. I already had 2 implants. We had a group of parents of young kids who were helping us, and for the most part, all their kids already had 1 or 2 implants. So it isn't for us personally, but it is because we know how miraculous this is, and we want other people to get the same benefits. So that was our motivation, all of our motivations.
I can understand that. So let's just be clear. When you had the surgery, whether first or certainly the second, did all of your hearing come back?
Well, this is what I was trying to say, is people, you can't get perfect hearing, even in my case. And look, I'm talking to you on the phone now. There's no lip reading. It's 100% hearing, and I may have to ask you to repeat things. I don't know. I don't hear perfectly, but the hearing is so great. I mean, it's I'd say it's like 95-99%. There are a few things. If you give me a name, I'll have a great deal of difficulty with that. Telephone number, less difficulty. Talking on a topic that I know about, virtually no difficulty. But my gains are the maximum. It depends on many, many factors. If somebody hasn't had any hearing for, let's say, 20 years, and then they get an implant, well, there'll be a lot of rehab, a lot of practicing listening and so on, and they won't get to the same level I'm at. Still, I don't know a single person who got an implant and wasn't happy. You are definitely going to get significant gains, and you will be happy, which is why I say if you qualify, do it.
That's Dr. Bill Steinberg here on Life Unrehearsed with Matt and Corey. Such an inspiring story, and we're going to go beyond just implants, Dr. Steinberg, and one of them is going to be related to a COVID-related challenge, particularly because of masks, and they're becoming a real issue for those hard of hearing that would typically read lips. And we're going to ask for your suggestions to make communication easier.
Life Unrehearsed, brought to you by Leanna Senior Transition Support, specialists in downsizing and seniors residences.
Welcome back to Life Unrehearsed. I'm Corey Sirota along with my co-host Matt Delvecchio, and we are talking to Dr. Bill Steinberg, recipient of a cochlear implant and an advocate for those experiencing hearing loss. We are in this pandemic where we have to be wearing masks all the time in order to feel safe. And yet here we are talking to someone who has experienced hearing loss. I imagine it's a real issue for people that are hard of hearing who would typically read lips. So can you give us some suggestions, Dr. Steinberg, about what might make communication easier?
Well, there's no question that people with hearing loss read lips. It's automatic. You don't even have to learn how to do it. It's just automatic. I've been doing it my whole life, and I still do it, even though I don't have to, in a sense, because I'm talking to you about reading lips. But it's definitely a help. My eyes always go to the lips. I'm not looking at faces. I'm looking at lips. Now, with a mask, it's much harder. Recently, my wife and I just got flu shots, and everybody was wearing masks. And both sides, we were wearing masks, and the people were having trouble hearing us. We were having trouble hearing them. It's very, very difficult. The masks muffle the voices a little bit, and, of course, there's no lip reading. So there are those clear visor-type masks. I'm not a medical doctor, so I'm not going to comment on the degree of protection compared to a more tight-fitting mask. But nevertheless, I'm sure it does provide a very significant degree of protection. So those are very, very helpful for people who do have a hearing loss of any sort.
What I found, Dr. Steinberg, is in my world where I do a lot of tours with families and particularly seniors, and this was becoming a real issue. So I ended up buying one of these clear masks, and I want to distinguish where I'm not talking about a visor that we would typically think of a visor. There's actually clear masks that go around your ears and over the mouth, and it's clear. I actually got it from Here Entendre, Quebec, and that made a world of difference for our clients that are hard of hearing. So they are out there, and we encourage you, if you know someone experiencing hearing loss, it makes a world of difference. Now, Dr. Steinberg, we want to get your advice from a whole range of generations, children, parents, and seniors. Let's start with seniors. What could you recommend to seniors if they're starting to experience some hearing loss?
Go to an audiologist and get a hearing aid. Don't make excuses. Don't worry about vanity. If you have a minor hearing loss, and if you're just starting to experience it, it is minor, then in all probability you'll get an in-the-ear hearing aid. You won't see it. Nobody will see it. You don't even have to adjust them. They just work, and you'll hear much, much better. So I strongly recommend that for people, seniors starting to experience a loss. A number of my fellow mayors wear hearing aids now. They're older and they wear hearing aids, and you don't see them. Really, vanity shouldn't be an issue. You look very stupid if you're constantly asking people to repeat. It's much better, even if you have more of a loss and you have to wear behind-the-ear hearing aid. Doesn't matter. Much better than struggling with a hearing loss.
Very sound suggestion. I couldn't agree with you more. So what about parents who think their child might be having a hearing issue? Any suggestions about how where do they even begin?
Well, they would start with their nose and throat doctor, and right after that would probably be an audiologist to do the proper testing and find out what the situation is. And they should do it as soon as possible, because with young children, they're sponges when it comes to learning, including learning languages. So you want them to be able to hear well. I mean, I am not bilingual. I can read French. I somehow got through the school system here in Quebec, but learning a second language, the first language was hard enough. Learning a second language, very, very difficult. So the earlier a young child gets a hearing aid, or if it's really, really bad, they're deaf or virtually deaf, then a cochlear implant, the sooner that happens, the better. They will have a much richer and better life.
We're talking to Hampstead Mayor Dr. Bill Steinberg here on Life on Rehearse with Matt and Corey. And Dr. Steinberg was a recipient of a cochlear implant and an advocate for those experiencing hearing loss. And Dr. Steinberg, we have about a minute left, and you were a real driving force behind, a movement to get cochlear implant surgeries done in Montreal. I actually was quite amazed in prepping and doing research. It was done in Quebec City. I guess the CAC has approved it. It hasn't been implemented yet. The pandemic really threw a wrench into things. But first of all, congratulations. This was a lot of hard work with you, a bunch of other people. Where do we stand on that? Is there any hope that something will be done in Montreal soon?
I don't have the absolute latest information, but it should start in 2021 next year. It would have started around the end, around now, in fact, if it weren't for COVID. But with COVID, so many things had to be put on the back burner. The budget has been transferred to Montreal to do, I think, 70 surgeries. The budget will probably increase with demand over time. But the hospitals have been identified. I believe it's the Royal Victoria Hospital and the Children's for a starter. It's now in the hands of the doctors, the audiologists, to set up the whole program.
Wonderful.
And as soon as COVID calms down, we have a vaccine or whatever, and they can get going with new things like this, then it's going to get going.
Well, fingers crossed that this comes sooner rather than later. Great work on that, and congratulations again. Dr. Steinberg, if people want to find out a bit more about cochlear implant or hearing loss, where would you suggest as a quick resource?
I forget the exact. I think it's cochlearimplant.ca.
Yeah, you have your own, which is quite interesting, cochlearimplant.ca. It's amazing, and we would suggest you go there. And of course, we can't forget our friends at Habilitas Foundation, the old MAB Mackay. I know they were helpful in your life, or certainly in my daughter's life as well. And I also mentioned here Entendre Quebec for those masks. They're amazing there. So, Dr. Steinberg, thank you very much again for taking some time on a Sunday to really enlighten us about hearing loss.
It was my pleasure. Thank you.
All right, thank you. Corey, what do we have coming up on the second half?
In recognition of Crohn's and Colitis Canada Awareness Month, learn why the future is bright for those suffering from IBD. That's coming up after the 4:30 news.